the traditional mammogram with the compression on one side and the compression on the other side wasn't the scary part, but most women don't just get the one image. They get 4, 5, 6, 7, 8, 9, 10 images of the same breast being radiated over and over again. It's still considered one mammogram, but the radiation goes, 6 times up, 7 times up, 8 times up. That's the exposure that could really wreak havoc over time.
We're exposed to so much radiation in our lives, and it's a good idea to do things that don't have radiation, if at all possible, which is what I love about thermography. Hi, everybody. I'm Dr. Lisa Gordon, and I have my friend Tammy Leiner here. She's the owner of Longevity Thermography, and she offers her services in my office, and I wanted to make sure that people knew about thermography as an option. So Tammy, would you go ahead and introduce yourself and let us know about thermography and how you got into it?
Good morning, Dr. Lisa. My name's Tammy Leiner. I am a clinical thermographer. I've been doing this for about 19 years, since 2004. I've been doing screenings in the U.S. Started out in Wisconsin, then went to Illinois and Arizona, and now I'm in the greater Washington, D.C. area for the last 12 years.
We're so glad you're here, Tammy.
Thanks.
And I'm so glad you contacted me, because I've always wanted to offer thermography as part of a wellness practice. And I'd like to have you tell us a little bit about thermography. What's it used for, and what makes it beneficial?
So there are many different uses for thermography, starting with the most common, or the one that most people know about or look at thermography with, is breast thermography, as it is a non-invasive, non-radiative way to visualize heat, activity, and function versus looking at mass or structure. So bone or mass is not visualized in a thermogram. It looks more at the activity level, so inflammatory levels, vascular processes, those types of things. So there's a very simple pattern that is present when activity is forming. It's a heat pattern, and bad cells tend to radiate heat as they're feeding and growing. So it's that sort of pattern that we're looking for. But other things that I think are just as wonderful that the thermography picks up is infections, so dental infections or skin infections. It looks at sinuses, congestive sinuses, dental TMJ factors. It visualizes the carotid artery, which is a stroke potential. If there's a lot of heat and activity in the carotid, it could be an occlusion. It looks at the lymphatic system. So congestive lymph is the lymph system is a life-sustaining system. It is the cleaner of the body, and if it's not moving, it generally is early stage disease. Digestive issues, everything from circulation to large organ function, full spinal, visual, varicose, lots of different things. So instead of the traditional structure or functional screenings like x-rays or MRIs or ultrasound or CAT scans, it's looking at functional. Thyroid function is a big one too. Digestive function, circulatory function, what is functionally going on. So for functional practitioners, this is an ideal situation.
Well, that's a great overview. I wasn't aware that all of those things would create something that could be seen on a thermogram.
Yep.
And I'm wondering, if somebody gets a thermogram and they get an indication that there's some inflammation going on somewhere, what happens then? Do they get sent to another practitioner, a medical practitioner perhaps, or some other kind of practitioner, maybe their natural practitioner? I guess what I'm asking, Tammy, is how does the reader of the thermographer know or does the reader of the thermographer know the cause of any of those kinds of indications that show up on the thermogram?
So the thermogram technician, as of myself, we take the health information and the images of the client. We submit it out to a medical doctor for an interpretation, and then within a 3 to 4 day turnaround, the physician that I get back the technician gets back the report, and then we kind of guide them to what needs to happen next. Do they need to see this practitioner? Is there an issue coming up? Do they need a different type of test? We kind of coach them, so to speak, on things that they can do proactively to, shift some processes in the body or send them back to their practitioner with a recommendation to, do other type of testing, whether that be, a structural test, a function, a mass test, or a blood test, based on the visuals from their symptoms and their images. So ideally, they go back to their practitioner to, go over the report and to ensure that everything, is working properly, functioning properly, so to speak.
That's great. So I guess it's the experience and where the location of the heat as it shows up. I know on my thermogram, I had some heat showing up around my thyroid, and I knew that my thyroid was something that I need to handle. And so I can go back to my natural practitioner who does actually what I do and get rechecked myself. And then if there's something in the area of the carotid arteries, then that would be an indication. Or if there's something in the area of the breast, then you would know who to send the person to.
Right. Yeah. So that's the ideal situation. And if the physicians who are doing the interpretation of the screening, visualize significant, they will recommend a clinical correlation or a different type of test to confirm or deny the activity levels. Now, there are times that people come in a completely stressed mode, and we do a screening for them, and their carotid arteries are very, very inflamed. And, we do ask questions like, this is a very stressful time for you, or are you stressed to get here today, to ensure that, they're not at significant risk for, heart disease or stroke or a heart attack. We ask questions, and we kind of, go along with what we see when we see some, areas of, like, say, the little jutting out here of the jaw, asking them, are you, do you bite down? Are you a clencher? If they don't put it on their paperwork, we are, kind of toned into looking at these activity levels, whether they be mild, moderates, or severe. It's an overuse thing where someone can carry a bag on their shoulder and always use their right hand, and their right shoulder is completely active. And, how much are you using of your left, or painful? We try to, kind of balance it out a little bit so clients can, kind of get that aha moment when they see the activity levels one-sided than the other. So
that's great. So a lot of people have been asking me in my practice because they're interested. They see that thermography is available and they want to know the answers to some questions. And what I would like to have you address is, how does this compare to mammography? And just maybe talk about that for a little bit.
Sure, that's easy. So thermography, as we stated before, is a non-compressive, non-radiative way to visualize activity, heat and activity. So breast tissue is fatty tissue, and it has a few veins. It has, of course, the nipple. It has but it's 95% fatty tissue. And fatty tissue should not have an over significant amount of heat happening in fatty tissue. So when we do a breast screening, what we're looking for is the temperature symmetry between the left side and the right side. So when the temperature symmetry is about the same left to right, and cool processes are visual, your risk factor is lowered for something on the significant side. So when the breast tissue, when one breast looks warm and the other breast is cold, there's something going on. It doesn't necessarily mean it's cancer at all times. It could be a breast infection. It could be a bug bite. It could be, some fibrocystic activity. But we have learned that if you have fibrocystic breast, which is dense fibrous tissue, if you have it on one breast, you generally have it on both breasts because it doesn't differentiate from one side to the other. So a woman who has a lot of dense fibrous breast tissue will generally be slightly spotty and warm on both breasts. And it's also symmetrical, the left side to the right side. It's the activity levels and the heat levels on a warmer breast. If it's in, a very, hot spot, specifically, that's an indication something's going on. And then scans over time will show if that area of heat has dissipated or increased in size and temperature.
Okay, great. And so do people typically get both mammograms and thermograms?
So most practitioners, if not all, do recommend a multimodal approach when you're using thermography. Now, I have many women who just use thermography, and I have many women who use ultrasound and thermography together. And then there's mammography every couple of years or so, something like that. But we do suggest if you have a high risk factor, and some of those risk factors include a strong family history, a lot of birth control or IVF treatments, hormone replacement therapy for significant amount of years, women who have never had children, women whose menstrual cycles started before the age of 12 and finished after age 50. These are all risk factors that can add up to a higher risk factor. So doing a multimodal approach on a regular basis is ideal. Most women don't have a significant health history, or a lot of those checking boxes on those factors generally tend to do this type of screening. And then every 3 or 5 years or so, they do a different type of screening, not to prove thermography wrong, but to prove it right. And practitioners tend to applaud this type of behavior. So that's the ideal situation. So we encourage women who have a risk factor on their breast scan to get a different type of test, whether that be mammography, ultrasound, or they're seeing their physician for an exam.
So I guess it's like mammography in a way, in that they are screenings that occasionally need more in-depth study. Is that accurate to say?
It's accurate. Yes, it's definitely accurate. But so many times, more than others, the more in-depth study from mammography to ultrasound is to rule out a breast fibroids, because most breast densities are fibrocystic or fluid-filled cysts in the breast. And they can't harm you. They're not, they're just dense tissues, and they're caused by stimulants, caffeine, sugar, alcohol, soda, carbohydrates. These are types of stimulants, that cause tissue to be aggravated a little bit. And so it generally is visual up in the upper chest area when you have that type of activity. But there are other things out there for women who are they're not on the mammogram protocol. They don't understand it. They don't, whatever that it is, at least we're doing something. And now we have an ultrasound, an ultrasound company that we can send people directly to if their scan is abnormal and they still don't want to do the traditional mammography. So we're thrilled to be working with another company in the area that's doing ultrasound. So
that's wonderful. I'm glad to know about that. And I also know that people are very cautious about radiation, as they ought to be. We're exposed to so much radiation in our lives, and it's a good idea to do things that don't have radiation, if at all possible, which is what I love about thermography. One of the things I love about it.
I read a study about 10 years ago, which kind of, really resonated with me. And it was a engineer and a scientist, and she stated that, the traditional mammogram with the compression on one side and the compression on the other side wasn't the scary part, but most women don't just get the one image. They get 4, 5, 6, 7, 8 images of one breast at one time if they feel that they're not seeing what they're getting. And that's the exposure that can really wreak havoc over time, because it's still, it's chalked up as one mammogram is this amount of radiation exposure. But when you're getting 6, 7, 8, 9, 10 images of the same breast being radiated over and over again, it's still considered one mammogram, but the radiation goes, 6 times up, 7 times up, 8 times up. And over time, it can disrupt your DNA and the activity levels, and you look at the number one cause of, cancer is radiation exposure. So overexposing is not good for you either. So that, like I said, that multimodal approach kind of hits all the buttons. As you know, when we were 20, 30, 40, they were like, mammograms start at 40 and they finish when you die. And now it's mammograms start at 50 if you're not significant, and you're done at age 80. And then when you're 65, it goes to every other year. So they took 25 mammograms off of the average woman's, screening, so that, because they know radiation is a problem.
Well, I've actually had that exact experience, Tammy. I had many mammogram views done not too long ago, and ended up with what I consider to be an unnecessary and very stressful biopsy. So, I kind of wish that I had pursued thermography then, and perhaps I might not have had to go through that. I know a lot of women have gone through that.
Right.
So, what can you say? People might ask about insurance, whether it's covered, how to pay for thermography, that sort of thing.
So, unfortunately, as you know, that mammography is standard of care, and insurance generally pays for it, or a portion of it. I had seen an article recently that stated that a non-insured woman, a mammogram is now costing between $600 and $900 each, where it used to either be free or under $100, $200. But for insured women that have a deductible of, like, say, 30% or, 20, 30, 40%, it can be just as significantly as far as costs go. So that's one thing that I don't love. But unfortunately, as I'm going back to this, insurance does not cover thermography. Neither does Medicare. They see that the standard of care is the only way that you can get partial or full coverage of insurance. However, you can use your flexible spend accounts. If you have a flexible spending or a HSA, you can use those accounts to pay for this. So a lot of people that have those HSAs can use these dollars, because it is a coded procedure. They can use these dollars towards it. I also work with women who are financially having a hardship, or that need a little extended time to pay for it. I'll take, a partial payment and then hold until the following month for the follow-up payment. So that helps a lot of women be able to afford something like this. So although it's not overly expensive, it still could be something, that people need help with. And as a female business owner, I understand that and try and work with everybody.
And could you give a range? What can people expect to pay for thermography?
Generally between $179 and $479 for a full body. So, from one region to multiple regions. So there are different, prices for different areas of the body. And so, affordability is important.
Yes.
For getting a full body screening, we had 32 images, and it only takes about a half an hour to have the entire body done, screened. So it's affordable.
Yeah, it sounds very affordable, and especially with the copays the way they are today, I think that it's a lot of people are really choosing to go with practices like yours and like mine, that don't go through the insurance, but end up being very affordable.
Right.
Even so, maybe even more affordable than if they were to go through their insurance and then have not only those limitations, but the having to deal with the copay and all of those kinds of things.
Exactly.
So yeah, I totally understand that. And as you know, I run my practice in a similar way. Could you, before we're kind of running out of time here, and would you mind telling us what is the process like? What do people go through when they come to see you to get the thermography?
Sure. It's a very simple process. So client comes into the room with they fill out their paperwork, they come into the room, and whatever region that they're scanning, we ask them to put on a very light covered robe. As we leave the room, they undress, kind of acclimate to the room temperature. We come back in and we go over the paperwork, make sure everything's filled out. We have questions on anything that is filled out. We place the client in front of the camera about 3 feet away. We are facing the computer basically while we're doing it, and we ask the client to disrobe, and then we take the amount of pictures for whatever areas that we're screening, whether it's breast or head or abdomen or full body. It's 4 basic turns: to the left, to the right, face forward, face backward. And then they, put their clothes, their gown back on. We step out, they change, and then we slightly go over the report just to show them what the doctor's, the likeliness of, what's, kind of going on. We submit the scans, we get them back in about 3 to 5 days, and we email them or paper copy them their report. If they choose to share it with their doctor, that's their end. But you get the results. This is one thing that I can tell you that clients love, is that, they're doing a report and then the doctor says, "Oh, you're fine." And they have no idea what the report says. This one is like, I know exactly what it says and I know exactly what it doesn't say. So it's much clearer than, "Oh, you're fine," or, "Oh, we need more tests," So they really like that. And then we recall them, as needed, every, yearly or whatever that is needed based on the results of the report. And then we go over it. If they need some more guidance, we refer them back to their physician.
Great. And so it's unlike a mammogram in that there's no touching of the breast tissue or wherever the scan is being done. So the technician is not touching the woman's breast, is not touching the person, other than perhaps to touch them on the shoulder to get them in the right position or something like that. So it's a very respectful process, of course.
Yes, it is. And we generally, we tell them, slight turn, just a little more to the left, a little more to the left. We're looking for that exact perfect picture so that there's no question that we get the area. We're trained on, positioning and focus and, temperatures and things like this when we're, we do the training situation. But no, there's not a bit of touching. And in fact, most of the time, the clients are like, "That was way more comfortable than I expected." So, and easy, and very simple and fast.
Well, that's been my experience with you, Tammy. And just so our audience knows, I do trust Tammy and her technicians thoroughly to do a great job. I've seen her training people. I've had her be my thermographer, and it really is not at all an unpleasant experience. I know that women go through to the mammogram and they just, it can be quite awful and quite painful. And this is just such a respectful and comfortable process. And I just really appreciate, Tammy, your time. Before we finish up, is there anything else you would like to share about thermography or about you and your business that you'd like to have people know?
I'm just beyond grateful to be able to serve and help and guide and even teach a little bit women about, the ideal, their ideal, what is your ideal, whether it's their breast health, whether it's their body health, and to be able to refer to great practitioners such as yourself is kind of, it makes me happy. It gives me joy to be able to give and share and to help, people on their boat, on their guide to, to wellness. And when, clients come, they come back because they feel heard. They feel understood, they feel listened to, and they're not being just, kind of set apart. And we take the time to speak and talk to clients, not just push them through. So I hope that one day you see this as an opportunity to visualize kind of functionally what's going on in your body. And I'm happy to help with any moving forward with that. And I thank you for this opportunity, Dr. Lisa.
You're welcome, Tammy. The way you're speaking about people being heard, it's so very important to me in my practice. And I'm so delighted that you're the one who called me about thermography. How do people get in touch with you, and how do people make an appointment?
So the best way to make an appointment, there's two. We have an online scheduler if people are more inclined to book online at a website, which is longevitythermography.com. Clients can check the schedule and see where we're going to be, at which location. Of course, we always love to come to your office the first Monday of the month, don't we? And then
we do have fun. We love seeing each other. Yeah. It's true.
Yeah. And I have a great scheduler. Her name is Kim, at a toll-free number, 888-580-0040. And she will take exceptional care of you and schedule you to, the office. And we are happy to assist anybody with questions, back to us. So concerns, issues, anything they need to talk about, we're happy to talk.
Well, that's great. Thank you so much, Tammy. I'm so delighted that I picked up the phone that day when you called and that we're doing this together.
Me too.
I am too. Yeah, it's so good. And I really do enjoy having you as part of my dream practice, really. I've always had
That's wonderful.
Dream practice of serving women's health, families' health. It's not just for women, it's for men. It can even be for children. And this is just a wonderful addition to the Natural Health Improvement Center of Columbia, Maryland.